ManaDoc provides instantaneous 24/7 one-stop comprehensive mobile medical services and health products for users. And with me is Dr. Rachel, co-founder and CEO, and also Dr. Siaw, co-founder and CEO. I know you recently just had an IPO. Congratulations on that. So set the stage for the company. Telemedicine is your industry. What is it exactly that you do? Dr. Rachel, do you want to start?
We actually provide all-in-one service platform. We have telehealth services. We do delivery fulfillment of medication. We also send doctors to patients' home when the cases are not suitable for virtual care. In our app, we have a marketplace as well. We also built a huge community of doctors and users. For the community of doctors, we have a large network of doctors in Singapore, Malaysia, and 18 countries. They will come in together and communicate with each other to share expertise.
So you mentioned you're headquartered in Singapore, focused in Southeast Asia right now. How many, you said 18 countries total?
For the 18 countries is our community.
Okay.
Yeah.
That's in. Now, you have an interesting face scan technology, right? Dr. Siaw, do you want to explain that?
Okay. So we have incorporated a face scan that is able to actually capture various parameters like blood pressure, pulse rate, just based on a 30-second scan, your mental stress score, and even your age score. I think it utilizes a technology called transdermal optical imaging. And we're about the first company to have incorporated into our system. So we're able to do a remote monitoring of our patients by just a camera on a handphone. And what is most amazing about this is we want to stress that this is actually with a margin of errors of maybe 7 to 8%. And if we detect anything that is unusual from there, we will definitely follow with further care and management and further confirmatory tests.
Oh, interesting.
It's extremely useful, yes.
Can I elaborate on that, the technology? Yeah, for the AI face scan, because we do get a lot of questions, how can a camera from a handphone able to pick up so many parameters, and what is transdermal optical imaging? This TOI technology is not new. It's actually from the same technology that we use for the pulse oximeter. During COVID, I'm not sure whether you recall, we have this pulse oximeter where we clip on the fingertip and where you get your oxygen saturation. So how did that pulse oximeter pick up the oxygen saturation is that it pick up the pulsation of the blood, the capillary blood flow. So from this pulsation, you correlate with the blood pressure. Yeah. So with that technology, we actually pick up this capillary pulsation from our face. And from there, the data is sent to the back end, machine learning, churn out the reading, and correlate back to the blood pressure for the particular patient. It means that for that particular user, if he uses his own account, the more he scans, the more accurate it is.
So what can that face scan tell somebody about? You mentioned capillaries, right? Blood pressure. What all can medical issues can it diagnose, or at least refer for further look?
We have to bear in mind this technology is used only for investigative purposes.
Okay.
It means that we use it as a way of triaging our patient, the severity of their condition. We do not use this as the main diagnostic tool.
Yeah.
So what it means is that when we talk to a patient over the video, we will ask the patient to get a face scan. That is to get a preliminary blood pressure reading from them to tell us whether this patient is safe to be seen over the video or in person.
Yeah, fascinating. How affordable is the service that you offer?
Okay, actually, coming from Singapore, we are the most affordable telemedicine platform. For as low as $5, the starting price, you get to see a doctor near instantaneously. And most of the time, you are connected to a doctor in less than 60 seconds. A patient will get to see a doctor online with just short span of time and with a starting price of $5.
Okay. I mean, that's amazing compared to what we pay here for healthcare.
I would like to add to that. That is just the $5 US dollar is just a starting price. We do actually, the prices do actually fluctuate with the timing and also the specialty. And and the expertise of the doctor and the experience. What it means is that in the morning, it can be $5 base price, but in the afternoon, evening, there's a surcharge, and in the midnight, there's a $25 more of surcharge.
I see.
And for senior doctors, they do actually charge a higher base price, $50 and above.
Okay, so like dynamic pricing.
So it's very
depending
dynamic.
Yeah, just like we see with Uber and some other.
Yes.
You're right,
Yes,
you got it right.
Yeah. What kind of conditions and patients are well suited for telemedicine?
Yeah. So for the last 3 to 4 years during COVID, we have more or less come to an understanding of at least 85% of chronic conditions, cough, cold, running nose, headache, diarrhea, vomitings, can be easily conducted by telemedicine. Around 15% of medical conditions, for example, where I need to examine the patient physically, like palpating the abdomen, this can be done through telemedicine. But there's always red flags. The way that we've done this is, in the course of any consultation, we find that this condition is not suitable, we'll escalate up. Either we send the doctor to the house, or we actually activate an ambulance in case of emergencies. So we're very good at that, and I think for the last 3 to 5 years, things has been pretty good. The outcome has been fantastic.
Yeah.
Yes.
Well, one thing that was really interesting when I was doing some research, was how you follow up, like the care after the consultation continues. Like, I feel like when I go see a doctor, they're like, oh, you need to exercise more and eat better. And I'm like, yes, and I do it for like 2 days and then I go back to my old habits. But if there was more, I feel like constant follow up on this, that might be better for people's health. And you do that, right?
Yeah, that's right.
So-
Actually, I'm glad that you are quite attentive to how the service is delivered. You're right, because a lot of other companies, they just stop right there. So when the video stop, the care just stop right there. But what we do in ManaDr's is very different. So when the consultation ends, we have an AI-driven technology that runs this entire operating system, where we will actually send messages to the patient in the app itself to inform the patient that if they are still not feeling well within next 3 days, they can actually come to our own clinic. We actually own one clinic in Singapore, which is which actually allows our patient to go to the clinic for follow-up if they're not feeling well. Yeah. So on top of that, we also have a clinical care coordinator. So what she does is that she will do a 1 month, 2 months follow-up for some patients who are under chronic care. For example, they are on obesity or weight management. So we do have this clinical care coordinator that keep following up on this patient. And in addition to this, we also have this automated, what do you call that? We call that data collection from a patient. So what it means is that the patient will be reminded to record their weight, their blood pressure, their heart rate in this diary, this virtual diary in the app itself. So at every interval, 1 month, 2 months, 3 months, the patient will be reminded. And at the end of it, the patient has the choice to share this diary to the provider. So you can imagine that even the provider has not been contacting the patient, but the moment that the provider talks to the patient in a follow-up, the provider has access to this full set of data shared by the patient.
Okay. Now we've talked about from a patient's point of view. What about a physician's point of view? What is an advantage for them to be part of this service? Dr. Siaw?
So the way traditionally medicine has been delivered is in a face-to-face when I see a patient. I got to do a lot of tests, check the blood pressure, look at the eye and all these things. Now, we have simplified the way healthcare is being delivered by the physician now. On a virtual care, the doctors do what they do best. They talk to the patients regarding the illnesses, the symptoms. Beyond that, anything administrative, anything that needs post-care follow-up is all done by the 24 hours care coordinators that attach to our doctors. Every physician has a 24 hours team with them.
Yeah.
Now, it is very interesting. Some of the doctors has given up their practice and joined us. They don't have to worry about overhead, getting inventory nurses. Within 5 minutes when they come to our platform, their first patient comes knocking at the door. and they start seeing patients. And that's the most amazing part. And not only that, they can practice anywhere in the world, anytime they like, as long as they're in a proper environment. They click on, they see a patient, they can see for the next 3 hours. After that, that's it. If they want to stop practicing for the day, enough for the day. And the amazing part is some of the doctors are not even staying in Singapore now. They can be in Switzerland, New Zealand. They work for 3-4 hours for today, then they close shop. Then they feel like to see patient again. So we have simplified the way, the processes for the doctors. We allow them to live different. We allow them to do what they do best, what they like best, which is talking to the patient.
Right, yeah.
And they love it.
Leave some of the paperwork
Yes,
like
right.
to the side and let them help people solve their health issues.
So we actually also have a companion to the doctors, meaning after they see a patient, there'll be post-follow-up messages and all this, it's all automated. So you can imagine last time I got to tell you, please remember if you have headache, 3 days later you need to come back and all these things. But the most amazing part is all this will be sent to the patients.
Okay.
And they got it there, without me having to scribble in a paper and pass it to the patient.
Yeah.
So much time saving, so much efficient, and the doctor love it.
Yeah.
Yes.
Nice. So finally, what's the roadmap then for ManaDr? What's next? Your public company, now what?
Oh, our roadmap is also in our prospectus. So we have raised some money during the IPO. So we'll be using the proceeds to expand regional, starting from APAC region. So there are a few target countries they are looking at because we have managed to find good partners, trusted partners to work with. We are going into Indonesia and also Malaysia and Vietnam. And these 3 countries have a combined population of 500 million. So that's a lot of work to work on. So at the moment, we'll just work on these countries. Secondly, not to forget, our entire back-end system is actually AI-driven. Without this AI technology, we will not be able to deliver services swiftly and instantaneously. So I'm not just talking about our AI health companion where the user can see on the app. We also have a system where we make sure all the data are transferred seamlessly moving in the back end so that when the doctor see a patient, they will be able to have access to this data. So this infrastructure is actually ongoing because as you onboard more doctors, as your users increase, you need to enhance your system. So some of the money will actually go into enhancing this operating system.
Yeah, makes sense. Well, thank you so much, Dr. Siaw and Dr. Rachel.
Thank you.
Thank you.
Thanks a lot.